interesting talk. And now I take this pleasure to introduce our next esteemed panelist, Mr. Gautam Khanna. Gautam is the CEO of PD Hinduja Hospital, and he's also the head of Hinduja College of Nursing. He has around 3 decades of industry experience globally. He's an active member of various leading industry associations. Currently, he's the co-chair of FICCI Health Service Committee and vice president of Association of Hospitals Maharashtra. He is an alumnus of IIT Kanpur and IIM Calcutta. So beyond the devastating humanitarian impact inflicted by the COVID-19 pandemic, the economic impact on healthcare sector is significant. So Gautam, we all know that everybody is talking about that the hospitals are profiteering. There is a lot of lack of trust. Press is after the life of hospitals. So I think there is a lot of mistrust which is being created. But I think the result which shows the analysis and the facts show that the return on capital employed in last 10 years, the hospital sector has been one of the worst as compared to the other sectors. So the facts may be different. Investors are getting worried whether they should invest because there are a lot of policy changes, the regulatory changes which are happening, the pricing changes which are happening. So what we want to know from you, because you are a veteran in this industry, can you please share your assessment first of the business impact on the hospital sector, and then what are some of the key learnings for us as leaders, and how can we maximize the opportunities in the new normal? Over to you, Gautam.
Thank you, Gaurav, and thank you, Amar and Neeraj, for sharing such inspiring stories. I was keenly listening to all your best practices. Thank you for sharing that. And so before I answer Gaurav's question, so let me put it in context that what happened. So I think Amar talked about the experience with the dental clinic, and in hospitals, when this pandemic struck, all of us were caught off guard in the sense that we knew it's coming, but since there was no treatment known, there was lack of clarity on what to do with it. So, one of the things which happened is that we had to quickly, all of us, all the hospitals, and of course we did, you have to get your infrastructure changed. And for perspective of people on this group who may or may not know, in a normal hospital environment, the rooms are positive pressure air conditioned so that the infection should go out, should not come into the room. While for COVID, it is negative pressure, that the infection should not go out. So you can understand that it is switching the air conditioning completely. And so if you do that, you cannot put COVID and non-COVID together. So you will have to have separate. So what this suddenly means is that earlier in a pre-COVID scenario, where you would have a patient who would come to triage, you would put them in the ward or you put them in the ICU and life goes on. Now, when they come into triage, if they are positive, they go to a positive ward. If they are negative, they go to a non-COVID ward. If you don't know, then they go to a suspect ward. So suddenly you have 3 combinations for the ward. Similarly, you have 3 for the ICU. So you have increased the complexity. So now to do all this infrastructure change, of course, you have to incur costs. And the biggest challenge faced by hospitals at that time was there was lockdown. So you can imagine to do construction, to do infrastructure changes in the lockdown was a nightmare. In Bombay, no trains, no buses. So you can imagine how life would have been. But of course, we all did that. And then you have to get protocol. And one of the things which we learned is that, and I'm going back to the learnings, that earlier we used to think that, I don't know this, so I cannot do this. But my biggest learning has been that lack of knowledge is not an excuse. Nowadays, like we quickly got a task force together and we got consultants. So these were in touch with people who were in Italy and Wuhan and US. So they got their protocols for their specific specialty. The non-clinicians got from other places, from Korea, from Kerala. So we quickly put the knowledge together. So what would have taken us years to do, the knowledge depth, we got it in a couple of weeks. So I think that is a big learning, that earlier excuse of my previous, I'm from the previous generation, that I don't know this, so I can't do. I think that doesn't stand any water. But the other thing about this is thinking about the patient. So you have to now at this point in time, we all of us had to re-examine our priorities. Now, re-examine our priorities means that what do we do? For example, even a simple question whether I should treat COVID or I should not treat COVID is a very, very strategic question. Because if you treat COVID, then you have to stop non-COVID services. Your electives will go down. Your financials will be you'll have a financial crisis. If you treat COVID, you close down everything. Then how do you restart? And then will all the stakeholders agree? And will the teams be available? So it is a big challenge whether the team is motivated and engaged. So you have to tackle through that, and I'm happy that all the healthcare leaders in the country have managed this decision making and have them come through this crisis. So when you re-examine your priorities, the only way to re-examine, and many people have asked me, how did you know what is the right thing to do? I told them I had no clue what is the right thing to do. I just did whatever I did because of my values, like Amar had said. This is his credo. So you go as per your values, you go as per your organization's value, and you do what is the right thing for the patient. Everything else follows. And in hindsight, people might say whether you did the right thing or wrong thing, who knows? But at that point in time, that's the right thing we did. So you did a lot of safety measures for the patients, the screening and the triage and the safety educational videos, even for our staff. So staff had to be educated. Now think about it, staff is scared, their families are scared. So you need to arrange for accommodation for people who don't want to go home to their old parents. So we have to arrange for accommodation. Then you have to arrange for isolation and quarantine for our staff, because these people in Bombay, you cannot have quarantine at home if you're affected and if you're asymptomatic. So, you have to, so all this adds up to the cost. So the issue about financial crisis is huge. So now when people say that hospitals profiteer, I just tell them that look at the losses which hospitals have incurred, and the way losses have happened in the hospitals across the country, and many of them are published information. There was a study by FICCI and Ernst & Young in April, which estimated that average loss per month is going to be 7,300 crores across 75 hospitals. Now the actuals are actually more than that. So hospitals are bleeding. Now in this question, on top of this, you have regulatory compliances, and government and ICMR, they are also learning every day. So there is a new advisory. So you are putting all this together. Now, in all this, there is an issue about mental health. I think somebody talked about mental health. So you have to arrange for mental health for staff. Then what we realized that for our patients who are COVID, you have to take care of their mental health also, because you can imagine they are in COVID ward alone for 15 days. So, you have to arrange for a counselor. And of course, you never get paid for all this, by the way. These are all, because in the government rates, which are fixed, these are all not included. But, you have to do it for the patient care for which you stand for. So anyway, you do that. And then I'm just going to now move forward a little bit. So all this happened. The teams came together. And the other big learning is that in hospitals, from a lay person's point of view, the most important person is a doctor and a nurse, which of course they are the most important. But it's like in an airline, pilot is the most important. But you can't have an airline only with the pilot. You need to have the airport, and you have to have the services and so on. So in a hospital, without engineering, I could not have done the infrastructure. Without housekeeping, without our food services, without our education services, you can't do all this without our admin people. So you understand that the teamwork, which is important in a hospital, is more important in this crisis. It was really emerged as a clear thing to me. Now, of course, we have opened up slowly. We are opening up slowly. We opened up OPD, little teleconsults we have opened, and of course, a little bit physically. Elective is still not open, but emergencies have always been running. So revenues are hit very, very badly. But one positive thing I think about this, and Neeraj talked about that, is that we've been talking about digital. I've been wanting to do some digital initiatives for 6 years. Didn't move. Now, in 6 weeks, I am through. So I've had video consults. I have teletriage lines with nurses. I've had analysis, AI and data analytics. So I've had all kinds of things. I mean, to give you a perspective, in the last 1 or 2 months, our video consult is more than 12,000. So can you imagine 12,000 patients have not come to the hospital, which is such a big relief for them and for, of course, for everybody, for social distancing. So that's the thing. And then you cannot ignore research, because this is the time where you need our research to do, because COVID is there. So what is the use of Hinduja Hospital being such a major research center when you don't do research on COVID? So we have to push that. So we have 19 research studies going on, COVID related, some global, some Indian. So you have to do that. You also have to arrange for, you learned many new things. So I'm going to just stop at that, but I'm going to talk about what I think is going to happen in the future going forward. So I think going forward, the ability to survive during a pandemic or any crisis, and I think we spoke about that the healthcare expenditure of India is very low, and I hope this is a lesson to the government and to all private players that we need to spend more on health. And to my friends who are watching here and people who will watch later, just think about it, that we as human beings, including me, we've all invested, you know, gold, stocks, land, flat, apartment, never invested in the most important asset, which is the physical body. So we need to invest in preventive healthcare. And the other most important thing is, we buy a car, we buy a motorcycle, government makes it mandatory to have an insurance. For a human being, which is such a precious asset, there's no insurance. So the big thing which came out glaringly in this crisis is that most people don't have insurance, and PMJY is for the lower category. And even if you have insurance, you are completely underinsured. So if you are, most people are insured for 2.5 lakhs or 1 lakh or something. So if you think about it, today in a large hospital in a metro, single room would cost, major surgery will cost 6-7 lakhs. 10 years later, it'll be 10-15 lakhs. Insurance is 5. You will always have a problem. So insurance, adequate health insurance and preventive health should be the two key lessons from here. But going forward, I think the most important thing for hospitals will be having strong SOPs, which, this crisis has forced people to put SOPs to differentiate through, having effective outreach and building your brand as for the patient quality and patient concern. And then can you do innovative stuff? For example, for this COVID crisis, we realized when people are in isolation at home, but COVID positive, they are really concerned. So we launched a COVID home care package. So now our doctor will talk to them, nurses talk to them every 8 hours. There is a reassurance. So these kind of initiatives really help. And then what has happened from the patient point of view? Patients now are hungry for information. So the new normal will be that we will have to provide more information. We will have to somehow continue to deal with the negative press, which people talked about. And I have this, what Gaurav talked about, that there's a lack of trust and negative press. And to just say last 1 minute, Gaurav, is that people in the country, we have gone through the stages where we thought healthcare would be free. So government would do, then you'll have charity hospitals which will do, then we went to the corporate hospitals. Now we are trying to figure out. So in all this model, it is not that one will work in isolation. Everything has to coexist. So if we want everything to go to the lowest cost quality denominator, you will have to understand that after a point, cost decrease will result in quality decrease. So in a country of India, which has different socioeconomic classes, you cannot have that. So people need to understand that the hospitals, the results are visible. If hospitals are not making money, for example, a trust hospital like us, I don't give a dividend to anybody. So what will I do with making money? It goes back to the patients. So obviously we are not profiteering. So it's just the impact. And I'm just going to stop at that. And I'll say that one last thing is that in this thing, which has learned that any crisis for the country cannot be handled by government or by private. It has to be handled by all of us as a community. Government, private hospitals, social communities, media, everybody has to come together to take care of the health of this country. So I'm going to stop at that. Thank you, Gaurav.
I think this was an excellent talk, and it's always a pleasure to listen to you, Gautam. And one point I wanted to highlight, that on behalf of this forum, So some of you might be thinking that we come on these kind of forums and we talk and we just go away and maybe something happens or not. But let me tell you, I think because you raised the point about the health insurance, we did a lot of studies, we did a lot of programs where we brought in the insurance company CEOs, we brought in the government stakeholders, we brought in the healthcare providers, and we did a lot of programs and we proved them beyond doubt that almost 50 to 60 crore Indians are left without any health insurance.
Yes.
And this is a huge number, in spite of the fact that we have Ayushman Bharat, in spite of the fact that we have a rich population, but there is a middle class, there's a complete middle population which is left. And we are very pleased to inform you, we presented all our white papers, and now you must have read in the news that government has started working on this, extending Ayushman Bharat too. So
Yes.
maybe it's a small change, but I think we all need to make sure that we work and make healthcare better for everyone.
So I think, Gaurav, just before you close, I think all the people who are watching here, who run the companies, my request is please make it mandatory for all your employees to do a health check every year. Just deduct
Yes.
some money from their annual CTC. So you'll just force them to do a health check.
I completely echo what Gautam is saying, and I think that is we are spending 80% of our amount on the curative. Let us focus on the preventive side.